Hello everyone. Today we will be talking about what are the lifestyle interventions which are required to decrease the blood pressure, or what are the lifestyle changes should be done by a patient with hypertension. So there are relevance to lifestyle changes. This is all this guideline. This is based on the European Society of Hypertension guidelines for the management of arterial hypertension 2023. So individual who follow a healthy lifestyle is known to have approximately 4 to 5 lower BP when compared to their counterparts. So whoever follow the lifestyle proper lifestyle will have a reduced blood pressure that is of around 4 to 5 millimeters of mercury, irrespective of underlying BP genetic risk, than those with an unfavorable lifestyle. Also, important thing to remember that the most important and well-established effective lifestyle intervention that have been shown to reduce premature cardiovascular morbidity and mortality are losing weight, the DASH diet, salt reduction, augmentation of potassium intake, engaging in regular physical activity, and structured exercise, and a moderate consumption of alcohol. So these are the factors which are important in decreasing the blood pressure, and these are the lifestyle habits which has to be followed by every patient of hypertension, or even by a normal person who doesn't want to land into hypertension or hypertensive category. So they have to follow this lifestyle modifications. So we will go through this one by one. So the most important one is weight reduction. So it has been seen in various studies that whoever reduces the weight or takes a low calorie diet is found to have the reduction of around 6.5 millimeters mercury of systolic blood pressure and 4.6 millimeters of mercury of diastolic blood pressures. So low calorie diet is of that much help. So if you reduce your weight, your blood pressures are supposed to be fall by 6 millimeters of mercury of systolic and 4.6 millimeters of mercury of diastolic blood pressure. So sometimes routine exercise, low calorie diet may not be sufficient. And in those specific group of patient, you may have to take a GLP-1 receptor antagonist, or you may have to, if there is severe obesity, that is BMI of more than 35 or more than 40, then you may have to consider bariatric surgery to get into a decrease your weight, and that will indirectly help in reducing your blood pressure. Another most important topic is the most important thing to be considered is restriction of sodium intake. So sodium is actually responsible to whenever there is increase in sodium in the blood or in the vessels. So it also will bring more water along with it. So sodium and water goes in the same direction. So whenever there is increase in H2O or water intake in the water in the blood vessels will lead to increase in blood pressure. So thus, if you reduce the sodium intake, your blood pressure is also supposed to reduce. So what the various studies have shown that if you decrease your salt intake by 5.8 grams per day, which is equivalent to actually 1 teaspoon of salt, if you reduce by that much, it has been seen that it reduces the systolic blood pressure by 5 and diastolic blood pressure by 2 millimeters of mercury. So also you should remember that 5 grams of sodium chloride will contain 2 grams of sodium. So this is normally equivalent to 1 teaspoon, which we talk in the general usage. So 1 teaspoon of salt is the normal recommended intake for any person or any patient. So next important thing is augmentation of dietary potassium intake. So this is important that you have to be considered that dietary potassium follows a U-shaped relationship. That means that if you take potassium in a sufficient quantity or the required quantity, it will help you in reducing the blood pressure. However, if you take the potassium in higher quantity or excessive quantity, that can lead to hypertension as well. So dietary potassium is associated with BP and hypertension. So you have to remember that. So in limited quantity, it will help in reducing the blood pressure, that is the U1. And if you take it more, and this may again lead to it will again increase the blood pressure. So it has to be taken in the recommended quantity. So recommended quantity which has been mentioned is that it has to be taken in around 75 to 125 millimoles per day. So that is the recommended intake. So the typical BP lowering effect, if you take around 60 millimoles of potassium, is that it will help you in reducing blood pressure by around 4 to 5 millimeters of mercury. So because potassium-rich diets tend to be heart healthy, they are preferred over the use of pills. So generally, if you want to take potassium supplementation, it's always recommended to take it in the form of potassium-rich diet and you should not take potassium supplementation. So diet is always better when compared to medicines or drugs. So good sources of dietary potassium includes all the fruits, vegetables, low-fat dairy products, selected fish and meats, nuts, and soy products. So generally 4 to 5 servings of any fruits and vegetables will give you around 1500 to more than 3000 milligrams of potassium. So recommended, as we have said, it was 1380 milligrams or around 1500 milligrams is the recommended one. So good amount of fruits intake and vegetable intake, which is a part of DASH diet, is important in reducing the blood pressure. Again, next most important thing is the increased level of daily physical activity. So daily physical activity or daily regular exercise is recommended. So what does the recommendation says that any person should do a activity which is equivalent to 10 metabolic equivalent per week, or if you count it in the time wise, a minimum any person should do a minimum of 150 minutes of physical activity per week. So if you count by day as well, it has to be minimum of 25 to 30 minutes of walking per day has to be done by every person, which will help in reducing the chances of developing hypertension by around 6%. Next is alcohol consumption. So intake of alcohol, too much of alcohol intake is also dangerous. So always the alcohol, if you take it in the moderate quantity or the prescribed limited quantity, it will keep your blood pressure in under control, and it should not be taken in more than recommended quantity. So recommended quantity, which has been said that should not be increasing by one or two standard drinks. That is, one standard drink is normally equal to 8 to 10 grams of alcohol per day. So any alcohol, if you're taking, it should not be more than 10 to 20 grams of alcohol per day. And this is slightly lesser for females when compared to males. Next, smoking cessation. Tobacco is the main risk factor for any cardiovascular death and also hypertension as well. So smoking has to be absolutely stopped or completely has to be limited, and this will help you in reducing the blood pressure as well. Other dietary intervention is that what we say is that diet against stopping hypertension, that is DASH diet, which is important, which contains basically of whole grains, fruits, vegetables, low fat dairy products, an increased quantity of potassium, calcium, magnesium, and fibers. This is the DASH diet. And if you take this DASH diet, even modest adherence to this DASH diet is associated with a lower risk of all cause and cause specific mortality. Another important thing to keep your blood pressure under control or to prevent you from getting blood pressure is to keep your stress and anxiety in as much as reduced as possible. So this stress, any stress and mental stress or physical stress and anxiety can make patient to develop a sudden increase in BP, and this will get normalizes when the distress is relieved. So these sudden fluctuations of blood pressure, high and low, is more dangerous than persistent when compared to the persistently high blood pressures. So this has to be kept in control either by doing meditation or breathing control or yoga. And also most important, one of the important thing is that now both the noise pollution and air pollution is found to be associated with increase in BP, incidental hypertension, and also end organ damage, and including vascular stiffness. So these are the important lifestyle modifications which are important. That is decreasing the noise and air pollution, managing your stress well, decreasing taking a DASH diet, decreasing smoking, moderate intake of alcohol, increased level of physical activity, that is minimum of 150 minutes per week, and dietary potassium intake should be moderate, and decreasing the sodium intake, and weight reduction. And also remember, weight reduction is the best method to decrease the blood pressure when compared to all the other lifestyle modifications.